Welcome to the Safe at School Back to School Forum presented by your American Diabetes Association. I am Crystal Woodward, the ADA's Director of Safe at School, and I am also a parent of a child, now an adult, with type 1 diabetes. Today, we are going to talk about the number one issue that is on the minds of parents of children with diabetes right now: sending your children back to school after having been home for over a year during the global pandemic. We have panelists here who will share their expertise and provide guidance on how parents, schools, and diabetes providers can work together to provide a safe and healthy learning environment for our children. As we go through our discussion today, it is important to remember that the rights of students with diabetes do not go away during the global pandemic. The association encourages parents, schools, providers, policymakers, and other stakeholders to approach the upcoming school year with an open mind and flexibility. Together, we can make sure our children with diabetes are safe at school. As we go through today's panel discussion, please type your questions in the chat box, and we will do our very best to answer your questions at the end of the panel discussion. Many thanks to Lilly Diabetes for its sponsorship of this event and our Safe at School Fall Back to School series. Now let me introduce our esteemed panelists. First, we have Dr. Anastasia Albanese O'Neill, who serves as co-chair for the American Diabetes Association Safe at School Working Group, and until 2021, was the Director of Diabetes Education and Clinical Operations at the University of Florida, Division of Pediatric Endocrinology. Next, we have Dr. Cynthia Munoz, who is currently the association's President of Healthcare and Education. She is a member of ADA's Safe at School Working Group and is a licensed psychologist and assistant professor of clinical pediatrics at the University of Southern California's Keck School of Medicine. Next, we have Dr. Henry Rodriguez, who currently serves as the co-chair of the association's Safe at School Working Group and is a professor of pediatrics and health informatics at the University of South Florida, and is clinical director of the USF Diabetes and Endocrinology Center. Next, we have Leah Wyckoff, who also serves on the association's Safe at School Working Group and is currently a school nurse consultant for the Barbara Davis Center for Diabetes at the University of Colorado. Leah is team consultant for the Diabetes Resource Nurses of Colorado, co-editor of the Colorado Kids with Diabetes website, and is the former president of the Colorado Association of School Nurses. I want to extend a warm welcome and many thanks to you all. So now we're going to start with our panel discussion, and we'll do that. I will ask the first question to Dr. Albanese O'Neill. Are students with diabetes at a higher risk of receiving or transmitting COVID-19? What do the current studies say?
Thanks for that question, Crystal, and thanks for having me here today. In general, students with diabetes are not at higher risk for becoming infected with or transmitting the COVID-19 infection to others. So students with diabetes should follow all the recommended precautions against becoming infected with COVID-19. So that includes getting vaccinated against it, using a mask indoors if they're not vaccinated, distancing, covering coughs and sneezes, washing their hands for 20 seconds after they do, singing the happy birthday song twice, and other strategies. If a student with diabetes does become infected with COVID-19, then it's extremely important to monitor that child closely. Remember, illness in diabetes can cause hyperglycemia and ketones. So parents and caregivers really need to monitor closely and consult with the diabetes care team immediately when their child is sick so they can get guidance. I would only add, and this is really important, that vaccination against COVID-19 significantly does lower the risk for all people, including students with diabetes. And this includes reduced risk for severe infection, hospitalization, and death. So we just heard, Crystal, from Dr. Francis Collins at the National Institutes of Health And he shared that 99% of hospitalizations for people with COVID-19 are for those who have not been vaccinated. So many schools around the country start in August. Today is July 15th. So if you, as a parent, or your child who is 12 and older, or other family members haven't gotten vaccinated yet, now's the time. So when this webinar is over in less than an hour, I would encourage you, make this your top priority for prevention.
Thank you. Does anybody else have anything they want to add?
Amen to the vaccination. And, you know, as I think most people have heard, I mean, it is expected that FDA will have emergency approval for vaccination for younger children. It is almost guaranteed not to happen before the start of school here in the state of Florida. Many counties are starting August the 10th. So we're talking about less than a month. And even if they do approve, let's say next week, I mean, you think about for the COVID, Pfizer and Moderna vaccines, those are going to require two separate vaccinations. And so folks aren't going to be fully vaccinated before school starts.
Henry, you're exactly right. So fully vaccinated means 2 weeks after your final dose. So if it's a 2-dose course and you have to wait 21 or 28 days between those doses, we're talking about, right, 5 to 6 weeks. So,
you know, from a mental health perspective, I know one of the questions that comes up a lot is around, you know, the due diligence that, you know, went into approving the use of vaccinations for children, you know, and fears that the process felt, you know, very like it was really fast. And, you know, was there this due diligence? I know that we heard, you know, similar concerns around the vaccinations for adults too. And I'm curious to know from, you know, our doctors on the panel around, you know, from all of you around any thoughts on that.
Well, I think there's been very rigorous review, both in the adults and as we're approaching it in children as well. So I think, you know, as a matter of fact, we're expecting that there's going to be full approval, not just emergency approval for adults. And I expect that that's going to happen for children. I mean, the studies have been ongoing and they're all certainly encouraging, as is the case with really any medication and certainly vaccination. There is certainly always the risk of having an adverse event, but there is no question, as Dr. Albanese O'Neill has really emphasized, that vaccination is definitely the way to go. It is far less likely that you're going to have an issue with the vaccination than contracting COVID and dealing with the risks there.
Thank you all for your responses and for chiming in there. So our next question is for Dr. Munoz. If parents are scared to send their children back to school because they fear it is not safe, what should parents do?
Right. This is a question that, you know, I hear very frequently. You know, the fears are very real. And you mentioned, you know, what should we do or what can we do when a parent or a guardian has the fear? You know, and I would also say, you know, what do we do when a child, you know, has fears? So first, you know, is going to reliable sources to get information, to make sure that, you know, we all have a clear understanding of the facts. You know, sometimes we rely on information or we're information we hear from, you know, people that we talk with or things we see on television, you know, really impact us and can, you know, create, you know, fears that we didn't even have, you know, and when we go to reliable sources, so one, of course, is going to be the ADA, Safe at School. Dr. Albanese O'Neill, you know, mentioned the National Institutes of Health, the CDC. So we have a lot of reliable sources. So that would be number one. Aside from these resources, I think that probably the easiest resource for most parents and guardians is to talk to your child's care provider. So this might be your child's endocrinologist. It might be your child's you know, pediatrician, but talking to these professionals about your specific concerns and questions can really go a long way. Another thing that is really important with children is to validate the concerns. So when a child expresses fears and worries about, just leaving their home, let alone going back to school and being around other people, I think that, letting them know that, this can feel scary. This is stepping back into a world that for, the past year and a half or so felt scary. And many were told it was a scary place where bad things could happen. So acknowledging that, reassuring children that the adults continue to do everything that they can to keep them safe, that can also be really important. And I think that could also be reassuring for the adults, knowing that schools have no interest in being known as the school where children, became infected or became really ill. And so schools are also going through processes and developing protocols to make sure that kids are going to be safe. So if you're not sure what those steps to keep your children safe are, ask. Get more information about what is happening. More than likely, it will be some of the very things that you've already heard today, with the physical distancing, the use of masks, and so many other precautions that we've been hearing about since the beginning of this pandemic.
Thank you, Dr. Munoz. Does anybody else want to chime in on that point? Thank you. So our next question is for Dr. Rodriguez. Should a virtual learning option be available to students with diabetes as they return to school this fall? Why or why not? And under what circumstances might a virtual option be warranted?
Yeah. So thanks, Crystal. I think this is an issue, as Dr. Albanese O'Neill pointed out. I mean, there are recommendations with regards to the CDC. In fact, they just issued new guidelines just this past week. And the circumstances really come down to what's referred to as mitigation strategies. So we've talked about this. So the distancing, schools were provided, at least in theory, dollars to revamp their ventilation systems. There is, I think the clearest recommendation for me at any rate is children and staff that are unvaccinated are supposed to wear masks. So, any child less than 12, well, there's no really option there because they haven't had the opportunity to be vaccinated. So I think it comes down to being aware of what the guidelines are, as Dr. Munoz mentioned, educating yourselves with regards to what the recommended strategies are, and then really meeting with, as you all typically do in terms of your diabetes medical management plans, meeting with your schools and assessing whether they're putting these practices in place. And it's certainly our hope that they will. And, honestly, Dr. Albanese O'Neill and I are here in Florida. And unfortunately, the options are somewhat limited with regards to virtual. That's not going to exist. Now, you can do online schooling, and that may be a choice that a family makes. But I think we all understand, and certainly CDC, even in issuing their guidelines, has recognized all of the challenges from a psychosocial standpoint that children have faced over this past year. And so getting them back to school is really focused on getting them back to normal from the perspective of their interactions with peers and others. And so I fully agree with trying to get back to school, but doing so in a safe manner, and really assessing what strategies there are in schools individually to keep those kids safe. And if a family feels that it's not a safe environment, then really investigating what their options are locally for addressing that.
Dr. Rodriguez, you mentioned geographical considerations. So I am in California. And so wearing masks is still, something that, we are doing. And, from a psychosocial perspective, if you live in a region that is no longer, for example, recommending or requiring masks for people who are vaccinated, but let's say that you feel more secure, more comfortable wearing a mask, or your child feels more comfortable wearing a mask, that is certainly an option. You know, and then it sometimes brings up the question, you know, for kids of feeling different, or is someone going to, you know, make fun of me, you know, because I'm still wearing a mask, even though others aren't. You know, and that I think is an opportunity, you know, to have a conversation about the importance of taking steps that will help each person feel more safe and comfortable in this environment where it sometimes feels like the guidelines and the rules are changing.
And they're likely to continue to change. So a local county here pretty much issued a statement just yesterday that masks for this school term will be optional now for those that are vaccinated in theory. But you know, these guidelines may change. Unfortunately, all of us are aware of that Delta variant that's out there that's more communicable and certainly more risky. And if localities see increases in numbers, I think we all need to be tuned in to make sure that those guidelines don't change and that we respond to them appropriately.
I did want to add that if a family chooses remote virtual learning for their child, they will really have to seek out socialization for their child, social activities, make sure they are involved with other children to balance having remote learning.
I also just want to add, I want to caution parents against getting caught kind of sideways in terms of virtual learning. Before the pandemic, most people weren't aware that virtual learning, online school existed as an option in many states, but it runs parallel often to school districts, and you can't go back and forth between the systems. At the height of the pandemic, students in many states had the option to go back to in-person school or switch back to an online curriculum. That's probably not going to be an option moving forward. People are going to, a lot of school districts are going to do away with that middle option and have in-person schooling or the online option. And so I think really get ahead of it. I'm recommending people get ahead of it now, talk to your school district, explore the online learning options, see if there's the ability to go back and forth, and if that's at the semester point or not an option at all for the entire school year before you make your choice.
Excellent, just excellent guidance from all of you. And I just want to chime in to say that the rights of students with diabetes don't go away during a global pandemic. So regardless of whether your child is doing in-person learning, virtual, or a hybrid, we want to make sure that the parents and the school work together at the beginning of the school year to develop what's called a Section 504 plan that lays out all the accommodations for that student with diabetes to occur during the school day, during field trips, extracurricular activities, during all school-sponsored events. And we're going to have a session next month. There'll be more information about that later. That does focus exclusively on federal laws, Section 504, and how to develop your child's 504 plan.
Crystal, if I may add, I think there are a lot of psychosocial benefits to having a 504 plan. And, you know, one of them being that it really provides the school team, parents and guardians, and the students with reassurance about, you know, the accommodations we call, you know, we call them, but, you know, about the things that they are permitted to do to, you know, stay safe, and also to, you know, feel comfortable focusing on their learning and on their, you know, whatever social interactions, you know, are available in the school setting, while at the same time feeling well, you know, health-wise. So one of the things I just want to quickly mention is that sometimes parents and guardians are asking, you know, when we are doing virtual education, you know, should we still be requesting 504 plans? Or a school staff member is saying, oh, well, we're in the virtual mode right now, so we can wait. I want to really highlight what you have just said. You do not need to wait. There are accommodations that absolutely apply, whether your child or the student is attending school in person or virtually, and they are extremely valuable.
Thank you, Dr. Munoz. And I just want to add one more point, and then we'll move on. The association has a wealth of resources, recommendations, guidance on our website specific to the global pandemic that parents can access by going to diabetes.org/COVID SAS. So be sure to do that. And then we'll move on. Mrs. Wyckoff, what is the key role of the school nurse in supporting students with diabetes? You're on mute, Leah.
I do that every time. Thank you for this question, Crystal. The school nurse coordinates and delivers the diabetes care. They will follow the diabetes medical management plan that comes from the healthcare provider. They are responsible for the training of staff and providing a safety net for that student to ensure that staff know how to respond to hypoglycemia, how to deliver diabetes care when they're out on field trips. In some states, they may be delegating to school staff, but always making sure that the school staff that are responsible for the student with diabetes have the training they need to care for the child.
Thanks, Leah.
And Crystal, may I add one other point?
Absolutely.
I think it's important, at least in my mind, and I think we're all probably in agreement in this, that it's not a one-way street, right? So the role of the school nurse and the administrative staff is also to provide feedback. If you think about the number of hours that children spend pre-pandemic at school, it's an opportunity to provide feedback with regards to how they're handling lunch or exercise or what have you, and offer that feedback back to the family and the healthcare team so that we can alter their management plan as is appropriate.
That's a great point. That collaboration is really important. The school nurse will be collaborating with the family, the student themselves if they are older, and the healthcare provider. And that circle of communication really will support the student in their learning.
Yeah, I just want to add, I'm going to take off my clinical hat and put on my parent hat. I have a child with type 1 diabetes diagnosed at 16 months. So she attended every grade from preschool, now is in college with type 1 diabetes. And I will say that some of her former school nurses are some of my closest friends because we had an extraordinary partnership. And frankly, they taught me things about my child that I might not have known. For example, in middle school, when she became very uncomfortable monitoring her glucose at the lunch table and wanted some privacy. So I think that partnership helps not only from a purely management standpoint, but also your child's psychological well-being and where they are in their relationship with diabetes. So that I cannot underscore that importance of that partnership and really approaching it with that concept, with that notion in mind that we're a partnership here with the diabetes care team, our family and this school, and we're going to get this done together so that the child can thrive.
Another word that I would add to collaboration, partnership is compassion. So recognizing that these relationships are, long-term relationships, and it's really important to find a way to maintain this communication, going, and to try to find ways to help this communication be, productive. And when I talk about compassion with school staff and school nurses, it's about recognizing that diabetes in children is not easy. It's not easy for anyone. But you think about the countless hours that parents and guardians spend awake at night. So a lot of sleepless nights for, the adults, the kids who are, woken up for diabetes management, overnight. And so it is not easy. There's a lot of sleep deprivation. At the end of the day, everybody really cares for the well-being of, the child and of the student. So keeping that top of mind, maintaining a sense of compassion, when talking to and about students with diabetes, is really, really important.
Thank you all. And I will just add that it's been my experience, both personally and professionally, that the school nurse is the student's strongest diabetes advocate. So let's not forget about that. That is a key role for the school nurse. Advocate through the 504 process, an advocate in identifying and obtaining training for school personnel, and just the school nurse is the key coordinator of care. And in that role as advocate, can advocate for those resources for our children. So, okay. So our next question goes back to Dr. Albanese O'Neill. And this says, what actions should schools be taking as they open up this fall to prevent exposure to COVID-19 and other transmittable diseases to children with diabetes?
So that's a great question, Crystal. It's a hard question. The good news is that the Centers for Disease Control and Prevention released updated guidance for schools last week on July 9th. So it's very new, just in time, really, because schools have a lot of planning to do. The document conveniently is called Guidance for COVID-19 Prevention in K through 12 Schools. And I think we could probably provide a link to it in our chat box. The document was designed for school leadership, but I think it has a lot of useful information for parents and other interested parties. If I had a child with diabetes in the schools, I would want to read this document. It's very helpful. So some key points, as Dr. Rodriguez mentioned, students benefit from in-person learning, and safely returning to in-person instruction is a priority for fall 2021. So we're trying to get students back to school in person. In the document, you'll see again that vaccination is the first line of defense. So parents and children 12 and older who are not yet vaccinated should make this a top priority. And in addition, you mentioned other diseases. Parents of children of all ages should make sure other vaccinations are up to date. So during the pandemic, there were a lot of missed appointments. A lot of people got behind on routine vaccinations. Now's the time to catch up on those, and this fall, including influenza. So in this document, you'll see that schools have been advised to consider a couple of things when they're putting prevention strategies in place. These are the vaccination rates in their school and community, and the amount of community spread of the virus, meaning are there high or increasing rates of COVID-19 infection in the community? And then they need to use this information to create layered prevention strategies. So what does that mean? It means that schools are going to combine a variety of prevention strategies, most of them you're familiar with, to reduce the risk of infection. And of course, the challenge here is that these layered prevention strategies are going to look different depending on where you are in the country, because there's different levels of outbreak, different levels of spread, different levels of vaccination. So these prevention strategies are going to be really important in the elementary school setting, where most kids are under the age of 12 and not eligible yet for a vaccine. And also, of course, important in middle and high schools where vaccination rates are low or community spread is high. So what are the prevention strategies? Well, masks. They're simple. They should be worn indoors by individuals 2 years and older, so not small children who are not fully vaccinated. And there's a lot of great guidance on how to help your child think about wearing a mask, putting it on their stuffed animal or decorating it, and make sure you label them so they don't come home with someone else's. So masks are going to be really important where we can't achieve distancing in the school setting. The distancing requirement has come down to 3 feet, and that's based on evidence from schools that went back in person, including here in Florida last year, and that happened pretty early here in Florida. So they're saying 3 feet of physical distance. And again, this is combined with indoor mask use for people who are not fully vaccinated. Then there's some other things that you can add. So screening, we've all familiar with the screening test for COVID, and this is important, particularly in athletics and contact sports like football or wrestling or things that you do indoors. So if we can identify COVID before it spreads to the entire team, and then we can keep the numbers down and keep those teams competing, or bands or choruses or things where you open your mouth and things come out of it, right? So this is important. Improving ventilations, as Dr. Rodriguez, ventilation systems in schools and on the school bus. Windows work well, keeping those windows open when you can, and of course, cleaning and disinfecting. And then finally, hygiene. So covering up when coughing and sneezing, or finding better ways to do it than doing it all over your hands, hand washing for 20 seconds. And this is key, staying home when you're sick. and getting tested so others can be notified of risk, but staying home when you're sick. I think we're going to see the end of awards for perfect attendance, and I was never a big fan of those anyway. So I think that we're going to see the end of that. Again, parents can expect schools to use a combination of these strategies, layer them on top of each other to reduce risk. It's going to change throughout the year. The number and combination used is going to be influenced by, again, vaccination rates, local infection rates. We're going to see a lot of different things. Again, like Dr. Munoz mentioned about the 504 plan, get with your school now and find out about their plan. Go on the school board website. This will ease your worries, and it will also give you a sense of what that in-school context is going to look like.
Thank you. Anyone else want to chime in?
I think the issue, the infrastructure issues certainly are a challenge, and one would argue that certainly that should have been happening over the summer and not just right now. That takes a bit of a challenge. I think, everything that Dr. Albanese O'Neill mentioned is critically important. I think one of the things that, in my opinion, is probably the most important and perhaps somewhat of a challenge is the testing, right? So, the CDC is recommending once a week, and in some cases, twice a week to test. And as was mentioned, I mean, this is a means by which not only can you assess what's going on in the community, but in the school situation, particularly identifying those that are infected and getting them out. And again, we've emphasized the importance of being in school, but the risk to others for a staff member or a student that's infected is great. And so that testing is going to be an important component of these strategies.
Thank you. For Dr. Munoz, many children have had very limited social interaction with peers since mid-March of 2020. What are the mental health risks and benefits for children who have been virtual learners, and what can we do to best support the return to in-person learning?
Right, this is such a good question. And there are many layers actually to this question. So first, you mentioned socialization. Yeah, absolutely. There are many children who have lots of energy and who really benefit from social outlets and opportunities to run around, to walk, to interact. We also know that part of typical development for children involves that social development. So it's not only something that children have missed, having these opportunities to interact with other kids, but it's also just an inherent benefit, developmentally. So what some children have also experienced is that there are some children, who actually felt some degree of comfort, being home because they felt like they were safer from the outside world that sometimes felt, scary, or that, these bad things could happen if they went outside. Also, there are some children who might be more shy or have some stress or anxieties around being in the outdoors, around a lot of people, or in the school setting. So there are some children who actually have really appreciated an opportunity to stay home. But there have been opportunities, and there continue to be opportunities to socialize or to interact socially through virtual means. And I do appreciate, I think we all appreciate, the fatigue that people are experiencing from these, virtual options. There are, kids who really just want to see other kids and to be in the same space as other children. So to help with the opportunity to socialize, yes, there continue to be some virtual options. I know with ADA, we have Imagine Camp, which is really cool because it's not just interacting with, other kids, in your immediate area or your state or your, or even in the US. I mean, there are kids internationally who are participating in Imagine Camp. So that's a really, really neat type of opportunity. There's Project Power, which is another ADA program and opportunity for virtual interactions, and so many others. As we've met, several have mentioned already, there have been increasing opportunities to go to school in person. There are some children who are attending summer school programs. There are less, children participating in these summer school programs. So that if that's an option for your child, or if it has been, that can be one opportunity to ease back into the setting. Looking to your local community for opportunities to socialize, and it might not involve fully enrolling and fully participating in a program that involves other people, but you might start off by just going and talking to get more information about that particular program or social opportunity. Then it might involve going and taking a look. Your child might want to go and spend just a short amount of time looking, observing, getting involved, and kind of gauging where their level of comfort is, adhering to the guidelines that we've already mentioned a couple of times, to minimize risks while interacting. Some people have used pods, so connecting with other children or other families where there's this level of trust and comfort, and being able to maximize safety for these groups of children or pods that can meet regularly. These can be some steps toward getting back into this world that feels suddenly so open, and where levels of vulnerability sometimes go up. The last thing I'll mention is there are in fact some camps and some retreats for children with diabetes that have started operating. They do have protocols in place for to minimize risk for the COVID-19 virus and the variants. So looking into your local community for these opportunities can also be another way of easing children back into a world of interaction.
Thank you, Dr. Munoz. The next question is for Dr. Rodriguez. What is the diabetes provider's role in making sure children with diabetes have everything they need to manage their diabetes at school and safely participate in all school-sponsored opportunities?
So I think first and foremost, the first and most critical is really working with the family and developing that diabetes medical management plan. And it's not as simple as insulin dosing. It really is making sure that, as you mentioned, having the tools available to allow them to benefit the greatest way possible of the educational environment at school. And so it's a matter of assessing their competencies and really working with the school personnel to assess, well, is this child appropriately monitoring their blood sugar, or are they administering injections? Do they need supervision? And it is not just a single action of completing that form, it's getting that feedback and reassessing. I think we have all appreciated out of necessity, making sure that, if there's a school lockdown, that there are supplies available. So again, it's a partnership with the family to make sure that there are supplies there available for that child. There should never be, or I shouldn't say never, but rarely be a situation where it's an emergency. If they have a medical device, an insulin pump, a continuous glucose monitor, there's always backup plans. Doing finger sticks, administering insulin via injection, all of those things should be in place so that we can minimize the impact that diabetes has on their school experience.
And I just want to say, Dr. Rodriguez referenced the Diabetes Medical Management Plan. The association does have a template plan on its website, diabetes.org/DMMP, but also to encourage parents, guardians, caregivers, if you haven't already done so, please make an appointment with your child's diabetes provider now to get that DMMP or those providers' orders done. It's so critical because we know how swamped we all get at back to school time. So, that DMMP is the prescription for your child's diabetes care and management in school. And it's also used as the foundation for the development of the Section 504 plan or IEP. So just so very important to work early in the summer to get the DMMP in place and to share that DMMP with your school nurse so that she can coordinate the care and take that to the next step.
And I think to put a plug in for our providers, after the first day of school is not the time to figure out that you need a diabetes medical management plan. I can guarantee you that all the providers' offices are inundated. We obviously want to have our children, our patients, the students attend school, and we want to do everything in our power to make that happen, but we want to do that in a safe manner, underscoring again the fact that the medical management plan should inform the greater individualized education plan, so that it isn't a standalone. It really is the ability for us as diabetes providers to assess the safety of that child, but then everything needs to be built around that, to allow for, again, them to really benefit most from their education at school.
Mrs. Wyckoff, did you want to add something to that?
I think he covered it. Thank you. Yes. Yeah. I think that's great. Yes.
Did you want to add anything? Saw that you unmuted, so I thought maybe.
Thank you. No, this was actually when Dr. Rodriguez was talking about supplies and what we can do to make sure that the students have the access to the supplies that they need at school, and it just occurred to me that while rare, I think it's really important to consider when supplies are kept under lock and key, making sure, so Dr. Rodriguez talked about, that there's the plan, and there's like the backup plan, and then the backup plan to the backup plan. So, if supplies are kept under lock and key, one, assessing whether that's absolutely necessary. Two, if it is necessary, ensuring that there are multiple individuals that can access those supplies and quickly. Now, that may happen more so when there is not like a school nurse on site, those types of situations, but really just paying attention to some of these little details that might happen and catch someone off guard.
I will add one thing, Crystal, is if a school nurse or family has concerns about the ability to access supplies and have supplies, most providers will have resources, including Lily, who is sponsoring, one of the sponsors for today, has resources to help families access their insulin and diabetes supplies. So that is key if there's any concerns about accessing the supplies.
Yeah, thank you. So we'll keep moving along. So Mrs. Wyckoff, how can parents and guardians work with the school nurse to make sure their children with diabetes are well supported? And how can parents and guardians be the very best resource for the school nurse?
Well, I think communication is probably one of the most important key factors to this partnership that we've been talking about. So starting right from the beginning, letting that school nurse know maybe your child was just recently diagnosed during COVID, or have they changed the delivery of their insulin? Are they now on a hybrid pump? Have they added CGMs? Maybe they went back to multi-dose injections. So just communicating early prior to school is best, so they can get the orders, that DMMP that we've talked about, and the school nurse can develop a care plan, get people trained. And then also coming up with a communication plan for the school year. How are they going to communicate what have the glucose levels been? The concerns that Dr. Rodriguez mentioned, how are they doing in school, in the lunchroom, on recess? What is that communication plan going to be? So developing that communication plan is really key. Now, as parents, they are wonderful resources. If a child upgrades to one of the more sophisticated insulin pumps that are coming out and all of the technology that we have today, they are often the best resources for school nurses to interact with that pump. There are not training pumps out there that school nurses have often have access to. So that pump that the child has is going to be the pump to learn about. The school nurse can use the online resources, but that actual hands-on is often that child's pump. And so the parent can be a great resource there for working with the school nurse, as well as, again, that advocacy for the child. The school nurse has the best intention for the child with diabetes as the parent, so they can walk hand in hand through this school experience.
Thank you. We're coming close. We're at 45 minutes. We're at 15 minutes actually. So what I'm going to do is have a last round of speed questions, and I'm going to give each of you a minute to answer, because we want to have some time at the end to answer questions that have been posted in the Q&A. So Mrs. Wyckoff, I'm going to start with you actually. Typically, what kind of training do other school staff receive to become educated and knowledgeable about diabetes?
The school nurse should provide all school staff with basic diabetes education. They need to know what is diabetes, why do they need insulin, what is the reactions to insulin, including low blood sugar, and how do I respond if I think a child is having a reaction to their insulin or to their diabetes. And that's basic. Everyone needs to know that. And from there, it goes on to the type of care that they are. If they're in the classroom, then they may need to, the teacher may need to know how to respond to the continuous glucose monitoring system, or if the pump alarms. If you have a delegation in states, then and the school nurse is not always there, then the staff will be delegated to give insulin. About half the states allow some delegation of diabetes care. So having a glucagon delegation is important where that is allowed.
Thank you. Dr. Rodriguez, what is the process for determining when a patient is capable of self-management at school? And what is the role of the school nurse in determining the student's level of self-management? I know we get this question a lot.
Yeah, and I touched upon it briefly previously. The issue really is, and it comes back to Ms. Wyckoff's comments with regards to the importance of communication. If you think about it, most diabetes care providers see the patient perhaps 4 times a year for about 30 minutes. So you're talking about 2 hours in an entire year, face to face. And, in the era of COVID, a lot of that's been via telehealth. So, having that communication back and forth, I can tell you at our center, when we work on the diabetes management plan, it's certainly a conversation with the parents to assess what they think their child is responsible enough to do, where they are in their stage of development, and it needs to be a continuing conversation. Input from the school staff, critically important. They may be comfortable doing something at home. Perhaps it was mentioned earlier, they want some privacy at school. They've gotten to that stage, as Dr. Albanese O'Neill mentioned with her own daughter. It is an ongoing conversation. And honestly, we all are very much invested in moving our patients or students along in being able to take greater responsibility to manage their diabetes so that they become fully independent and comfortable in caring for themselves.
Thank you. Dr. Munoz, one last question for you. My child feels like her classmates are watching her when she checks her blood sugar or gives herself a bolus. What can parents and teachers do to make sure students with diabetes are not singled out and are not treated differently from their peers?
Right. So Very important question, because every child, will feel very different about their diabetes and other people knowing about it. So, if in this scenario, the child feels self-conscious, or just doesn't feel comfortable, being stared at or looked at or feeling like they are, and who does? I think it starts with looking for an opportunity to educate. So, is this student, interested and feeling comfortable, talking with another student or with their class about diabetes? For older children who are on sports teams, including like cheer teams or academic clubs and so forth, do they feel comfortable, and are they interested in having a conversation about diabetes? So demystifying diabetes can have a powerful effect. People usually stare because they're curious, they don't understand. I think that can be helpful for a student with diabetes to hear. And, really at, an age where, kids might also feel, self-conscious about other things, let alone diabetes. I think it really is important, to have a conversation, with that student about, feeling, that people are looking at them. Again, just looking for opportunities for education. Not every child is going to want to do that, and that's okay. If that child is not interested in doing you having an educational opportunity with the classroom, or talking, with a friend or a couple of friends, then, maybe having a conversation with the school team around a place that student can go to have a higher level of privacy can be another way of approaching it. It really will depend on the child. I think oftentimes we think, don't hide it, you shouldn't be ashamed of it. Sure, we don't want, kids to feel ashamed or feel bad about having diabetes, but we also need to acknowledge and be respectful of their journey with diabetes and how they feel sharing it with others.
Yeah. Thank you so much. And one last question for Dr. Albanese O'Neill. From a diabetes educator perspective, what accommodations should parents request for their child with diabetes when they return to school this fall? Just maybe a couple examples.
Absolutely. I just wanted to add a pro tip to Dr. Munoz's last point. And for diabetes devices, unless there's a compelling safety reason not to, silence those alerts and alarms. A teenager doesn't want their diabetes devices chirping and beeping and drawing attention to them at all times. Sorry, Crystal, I had to throw that in. Accommodations are essential. Quickly, right now, if you don't have a diabetes management plan from your diabetes clinic, go get one. Your child may not have a visit until after school starts. Get your hands on the DMMP. That's the foundation of accommodations you're going to put in place in school. Number 2, contact the 504 coordinator at your child's school. This is essential business. You could set up a virtual or in-person meeting prior to the school year, meaning now. We need to figure out who's caring for that child. Is it the school nurse? Is it a staff member? Get to know them and assess their level of understanding of the devices and diabetes management plan your child used. I did that every year. I never regretted it, because sometimes my kid had on a new pump or CGM. And I'll say this as a diabetes educator, we want to make sure that that person has the tools to get the job done, whoever they are. There are some excellent resources on the diabetes.org /safe at school site. This includes, so what kind of accommodations? Basic accommodations for diabetes. Can my child go to the bathroom when they need to if they have high blood sugar? Can they drink water without penalty? Can they monitor their glucose during exams? Will they have extra time for testing if they have highs and lows and need to step back from that test? So these are essential, specific to COVID-19. The child needs a clean space to perform diabetes care. So in the past, a lot of kids with diabetes, especially in the elementary school setting, went to the school clinic, right? Or sometimes the school office. But if that's where other children are being assessed for viral illnesses and fevers, it's not the best place for a child with diabetes to do their diabetes care. So I would write into that plan, where is the child going to have a clean, right, space to do this work? And then also you can look at those resources online, because I know we're almost out of time, but cohorting or podding, as Dr. Munoz mentioned, is an option. encouraging, again, face coverings, especially where we don't have high rates of vaccination or for people who aren't fully vaccinated, and other accommodations related to COVID specifically that would be helpful for your child. So, and I'm going to stop there because there might be some additions in the group.
So thank you so much for your response, Dr. Albanese O'Neill. And we have time just for a couple of questions. So I'm in all fairness, I'm just going to start from the top. Please provide your input regarding this. A parent frequently changes the carb to insulin ratio and advises the nurse to adjust the BG entered into the pump by plus or minus 25 or 50, depending upon the direction of the arrows. Thank you. So
Boy, I think that really depends on that relationship and what's permitted at that school. So there are, instances where that direction is allowed with the parent alone without input by the diabetes care provider. In the DMMP, we can, if allowed by the school, provide those kind of guidelines as to what's permissible for those adjustments. But again, this is where communication amongst the family, the school, and the diabetes care provider is critical.
Yes, so can I just add that should be in the diabetes management plan? And if those adjustments are going to happen for that individual child, and I think some clarity on if the parent is not available and they have been designated as somebody making those adjustments, what's the backup plan? And that's reverting to what the written orders say.
Thank you. Next question. What about students who have already had COVID? What research has been done that they still need the vaccine without testing for antibodies? Does anybody want to answer that one?
Well, I think the evidence certainly suggests that there is at least temporary immunity that follows a COVID infection. I guess the good and the bad news is that those individuals that had a mild course are likely to mount a less vigorous response to the vaccine. And so their protection might not be as complete, so to speak, as someone who has had a very severe course, perhaps even ending up in intensive care. That the evidence, at least to date, suggests that their immune response is much more vigorous. So the general recommendation has been, following a period of recovery, that individuals that have had COVID do indeed get vaccinated as well.
Thank you. The next question, I have heard of several individuals who have lied about their child's age to get them vaccinated. Are there reasons that there is a cutoff of 12 years old?
It's because that's where the research, that's the age to which the research was conducted. And now research is happening in the younger age group. So we have evidence on the vaccine's efficacy from 12 to 17 years old. That was done after research was done on adults. And that's how research typically happens because children are vulnerable. And now we're not me personally, but scientists are conducting research on younger children. And those are the results that Dr. Rodriguez mentions we're waiting for. And that's why the vaccine was not indicated for those young children yet, because we don't have evidence to support it.
And just to clarify, we are not advocating that families lie about their children's age to get them vaccinated.
Exactly.
So we have time, I think, for one more. If your type 1 child has the vaccine, but your younger 3-year-old does not yet, is it safer to keep them home again or wait? Where we live, they don't think masks and COVID are a big deal.
This is a challenging one, right? Again, it's not going to be a satisfying answer, but it really comes down to assessing what the relative risks are. I think from the beginning of the pandemic, certainly here in the state of Florida, the major emphasis initially was to vaccinate the most vulnerable elderly individuals. And then it becomes a matter of potential exposure to other family members and so forth. I just want to emphasize again, as our other panelists have done, we certainly recognize that there truly is a value to getting children back into school. So we want to do that, but we want to be able to do that in a way that's safe for not only that individual child, but their family as well.
I would encourage this commenter to talk with the diabetes care team in their local area. I'm not sure where they're from, to get some guidance. And I would just add that every child with diabetes is an individual, and keeping your child at the center of your decision making really is the best approach, because there are a lot of unknowns. And so I think if we approach that child as an individual in the context where you live, again, with that guidance for the diabetes care team would be a great approach.
I actually am going to throw out one more question, and Dr. Munoz, I think this might be for you. Students could not identify with other students. There was a psychosocial dynamic to it that affected many students. Students began to use a mask to hide behind or become dependent upon. There were injuries, illnesses hidden by masks that occurred. Do you have any insight about that, hiding behind the mask or becoming dependent upon that? I'm not quite sure I understand the question, but there is some concern about the psychosocial impact of wearing a mask and not being seen or hiding behind. I'll give you just maybe 30 seconds and then we'll wrap up.
Sure. So, right, I'll answer this question to the best of my understanding. When I hear, hiding behind the mask of, from my mental health professional lens, I'm thinking about this literally and figuratively. So when we think about, using a mask, there are certainly recommended, uses. And recommendations around the masks, for safety, to minimize risk for infection, all of those things. The concept of hiding behind the mask may allude more to feelings of, insecurity and feeling more secure when having something literally or figuratively, hiding you or covering you. And so, if there are, concerns around a sense of, security and comfort with oneself, or comfort and security around others, if that has come up, for your child in a way that wasn't there, pre-pandemic, it could be related to specific fears that have come up related to the pandemic. Children, it's more difficult for children because it's been difficult for adults, right? But to understand what the COVID-19 means, what the pandemic means, what being ill means. So it certainly brings up opportunity to have a conversation around, what are those fears or stresses or insecurities about? Are they related to the pandemic itself? Are they related to, diabetes and a feeling of being different, which we know can absolutely happen for children of all ages? So having those conversations to better understand if you're looking for additional support, seeking guidance from a mental health professional or your diabetes care team. If you want to find a mental health professional with expertise in diabetes, you can certainly look at the ADA's mental health diabetes provider searchable website, because it will list mental health professionals with expertise in diabetes across the country. So I think it's just, gathering more information from your child and really education around, what happens when you feel different, whether it's because of diabetes or something else, and how to promote, that sense of, security and confidence for who you are as an individual. So it doesn't really touch completely on the topic, but I think it gives us a place to start.
Thank you so much. So I want to thank our outstanding panelists. I think this has been a very informative discussion. Lots of nice, great tips, guidance provided from our expert panel. And we thank everyone who attended this Back to School Forum today. We hope this guidance and information has been helpful to you as we are working together to maneuver through these challenging times. Our next fall Back to School event will focus on legal protections for students with diabetes. and the development of your child's Section 504 plan. And there was a link, registration link, put in the chat box. So be sure to register for that next session on August 12th at 12:30 p.m. Eastern Time. Please know that your American Diabetes Association is here for you. A link to this forum will be available soon if you'd like to watch it again, or if you'd like to share it with parents or others who are responsible for caring for students with diabetes. For more information and specific recommendations, please go to diabetes.org/safe@school. Again, many thanks to Lilly Diabetes for its sponsorship of the Safe at School event and our Fall Back to School series. And again, thanks to all of you for attending this afternoon. Take care.
Thank you, Kristen.
Thank you.